and welcome back to our Charter School Innovation Series on Season 2 of the Get Schools on Public Education podcast. I'm your host, Brittany Baker, and remember, charter schools are free, public, and open to all. I had the privilege of speaking with two school leaders who are dedicated to nurturing future healthcare heroes. Nationally, we are experiencing a nursing shortage, and the Health Resources and Services Administration projects a shortage of more than 78,000 full-time registered nurses by 2025. Today, we're spotlighting two charter schools dedicated to training the nurses of our future to meet our nation's healthcare needs. Our journey begins at the Rhode Island Nurses Institute Middle College, where this school leader's entire career has been focused on the health of patients, families, and communities around the nation.
I am a registered nurse. And why I am running a charter school today is because I needed to address two pain points: the need for more nurses in this country and the need for more diverse nurses in this country. And when I look, and the research is very clear that when nurses reflect the culture, the community, the language, patients do better. So I'm in this space because I care about health, the health of patients, families, communities. And so when I look at the nursing workforce, because I believe nurses can have big impact and do have big impact on improving health. And then when I look at going down the educational pipeline, I see the biggest barrier for many students and those who are underrepresented in the nursing workforce is the pre-collegiate pipeline, public education. And so I said, how are we going to address this? We need to start a nursing high school. And the way to do that is through the charter school movement.
It all started in Providence, Rhode Island, where they opened their first school in 2011. Dr. Pamela McCue is the CEO of Nurses Middle College, a network of nursing charter high schools, also known as NursesMC. Their flagship school in Providence is ranked number 1 in their state for college credits and workforce credentials awarded to its students for the past 5 years. The network opened another school in Albany, New York during the fall of 2023, and they are continuing to expand. I asked Dr. McCue why there is such a demand for this type of public education model.
Choose our Scott Charter School for a number of reasons. Number one, I believe the career opportunities and that we are bringing college level learning to the high school. But I think more importantly, parents are choosing and families are choosing is because of our culture. We're delivering education through a lens of health. And our culture is holistic. We meet students where they are. We meet parents and families where they are. We connect students and families to our outside resources in healthcare. So I think, yes, it's our academic rigor. Yes, it's the career opportunities, but it's also the way we deliver education through a holistic approach that really addresses the whole child, the whole family.
Like all public charter schools, there is no cost to attend. And at this charter school, every student earns at least 3 transferable college credits, with students at the Rhode Island flagship school earning 16 credits on average. Each student also graduates with a certified nursing assistant, also known as CNA credential. So they're graduating ahead of the curve. And in some instances, students are able to fast track into the workforce and eliminate a year of college tuition. Let's listen in on some additional unique features about this school model, including key partnerships.
We connect our families to their community health resources. In addition, we have strong partnerships with our colleges of nursing because our students begin taking college level courses as early as in 11th grade. All of these courses are transferable into a nursing or advanced healthcare provider curriculum. And then, of course, it's our community partnerships. That's where our parents and families are. And it's those community partnerships that is so very important. So the uniqueness of the model is, yes, the career preparation, but also the wealth and breadth and essential of the partnerships we bring.
And 100% of students are required to earn an internship experience. This is crucial to a student's development and career path. Connecting learning to real world experiences is a vital part of the charter school model. I remember from my days as an early childhood charter school teacher, there was a section in every lesson plan for us to talk about how we're going to apply the lesson to what is actually taking place around us. This type of practice from K all the way up to 12 positively impacts students. While we're on the topic of impact, let's find out where some of the graduates from Rhode Island Nurses Institute Middle College are today, starting with a young lady named Glennie.
Glennie came to this country from another country, or very young. She didn't speak any English, and she had to, at many times, be the when she did be the interpreter for her family, and then became very interested in the healthcare profession. Wanted to come to Rhine Middle College, and she just graduated this year with 16 plus college credits, very interested in nursing. Another story that we're so excited about, a 2015 graduate of Rhine Middle College, Amber, graduated from the University of Rhode Island as a registered nurse, has been working in the field, and we just hired her as our school nurse.
It speaks volumes about your program when students want to come back to inspire and serve others in their very own community where they were once inspired. The Nurses Middle College Network is continuing to replicate the success of their flagship school by soon opening another school in Nashville, Tennessee. Our next school leader is out of West Virginia, where she started her career as a clinical psychologist. With her extensive experience in mental health support, she saw a lot of hope in our youth and wanted to work with college students. She earned her PhD and began working with students at community colleges.
It's an incredible population of students. About half the people who go into college in the United States are at a community college. It's a really great way to help make sure people have access and that they get the skills that they need to get into jobs. And that really aligns with me. Economic development and job creation is really in my wheelhouse. So I'd been working with community colleges and then had the opportunity to go to Washington, D.C., where I worked at the United States Department of Education, and really learned more from my colleagues about what was possible in the K-12 space. Charter schools are so diverse that you see a lot of different kinds of innovative programs come out of them. And so when I moved back to West Virginia in 21, we saw that high school students here in West Virginia really didn't have access to college while they were still in high school. And so many states, you see early college programs, you see students who can earn an associate's degree while they're still in high school, and that structure just did not exist in West Virginia. And so we opened a charter school concurrently with the community college. And so the idea is that students in high school are doing community college classes, are doing college. They graduate with me with 60 credit hours, so they're halfway to their bachelor's degree.
Dr. Casey Sachs is the president at Bridge Valley Community and Technical College in West Virginia. Their charter school is called the Workforce Initiative for Nurses, also known as Winn Academy.
We started with nursing in West Virginia because there's just a critical workforce need in the state, that when you look at our Bureau of Labor Statistics, labor market information, and labor market data, there's this huge gap, that there's thousands of jobs that are open, and the people who have the skills to move into those workplaces don't exist. And they're really good jobs. But when you see something open in the workforce where you really recognize we can make a huge difference both for families, a student who comes out of my nursing program and starts making $70,000 a year as a 19-year-old, that's an incredible position to be in. And so it's really figuring out how do you connect all those dots so that students can have access to where there's this great labor market need, and prioritizing that, and then sequencing classes so that they can get those things. We have 2 large hospitals here in Charleston, and both have said, what do we need to be able to get younger people into clinicals? What do we need to be able to do to help you? What kind of support do you need? And so it's been that sort of marriage of having those great, incredibly important partners who said, yeah, you can figure out how to get younger people through. Let's do it. And so it made a difference to really be able to get started. And students understand nursing.
For many students who choose this charter school, their kids want to join the nursing workforce, and they're ready to get a jump start on their careers.
They're ready to get jobs. They're ready to move sort of out of that traditional high school experience, and they really are interested in skill sets that are going to help them for employment. That anything we can do to align that for their kids, they recognize that they have kids who just are ready to move into those experiences. And a few of my parents have said their student is who brought this to their attention and said, hey, Mom, I really want to go do this. So I think that's great. But a few parents have said, we've done the math and you're saving my family. In one case, a family told me we're saving them $70,000. That the amount that it would cost for them to send their daughter away to a residential college to get an experience like this. My community college has an agreement with our local flagship, WVU, signed a what's called 3+1 agreement in nursing. So as we've packaged a lot of stuff into nursing, but what that means is that students who go through our nursing program can do 3 years with us and then just 1 year with WVU and finish with a Bachelor of Science in Nursing from WVU.
In addition to working with WVU, West Virginia University, Winn Academy partners closely with their parents and leverages an online tool to help keep them informed.
So it's an online course platform for parents where they get regular updates, where they hear what's going on this week at the college, what kinds of things is my student hearing, because students have different levels of ability to go home and remember to tell their mom or dad or their grandma, hey, here's what's going on. And that's been great. And then parents choose what they want to get more involved with.
And this transparency and accessibility fosters a strong partnership with parents. Listen to these next stories about student experiences, starting with a mom who graduated from the community college. She loved her experience so much, she enrolled her daughter.
I can think of one mom in particular. She had done her associate's degree in nursing here at the college, and she only graduated a couple of years ago. And so she knew our faculty. She knew what her daughter was getting herself into. She firsthand, she'd just done it. And so she was a good one. We had one young man who came in, and he was their valedictorian this last year. He really stands out. He plays traveling hockey, and so we had to do some course scheduling around his hockey schedule, which was kind of a fun challenge for my team. But he was amazing, and I think part of what blew me away about him was that he talked about thinking, first of all, he said, I thought community college was going to be a joke. And he said this was so much harder than anything I had ever done in a traditional high school. He wasn't sure if he wanted to leave his traditional high school and come to the Winn Academy. He was like, I'm comfortable here. I have friends here. Maybe this isn't what I want to do. And his mom said, no, this is really great. You need to do this. And he talked about being so glad that she encouraged him, because it was just life-changing for him, that it set him up for college. It set him up for some future success that he hadn't even considered. He walked away from the Winn Academy with all these college credits completely paid for, that his parents and his family didn't have to worry about, that he didn't have to take on debt for. And I think just the impact for him that he's articulated already, and he's only 18, and for the changes that'll impact for his family, it's just such a big deal.
Winn Academy provides resources and specialized support to their students. On top of that, students receive hands-on experience to prepare them for the nursing workforce.
So there's a lot that our nursing program's doing. Our nursing dean is one of those amazing, innovative people who is constantly thinking about how do we improve this program. So it's everything from how do we more intentionally retain students? We've started doing mindfulness training with new nursing students. How do you be more mindful? How does this help your practice as a nurse? How does this help you as a human? So it's everything from how do we help individual students? And in that same student support vein, we have a program on campus called Ascend, where students who need financial support can go, who need extra counseling or coaching or whatever it is. Our facilities are phenomenal. We spent $3 million from a grant from the governor a couple years ago to put in what's called our Booker T. Washington Nursing Wing, and it's a simulated hospital wing. to pass the state nursing board exam.
Charter schools are relatively new in West Virginia, with the law being recently enacted in 2019. There are a lot of people who still don't understand that charter schools are indeed public.
And so sometimes I would talk to people about, we have this amazing charter school and more kids should take advantage of this. It's so good for families. And people would say, would misunderstand and think that it was private or think that it was somehow not a public experience, or that just a lot of misconceptions. And so I've spent just a lot of time saying charter schools are public schools. We would enroll any student who wants to come to us. We do have students with disabilities who have enrolled in these programs.
So what's next for Winn Academy? Expansion, with an advanced manufacturing technology program starting this fall. The program will prepare students for a career in modern manufacturing environments. You can support Winn Academy, Nurses Middle College, and all of the important work they are doing for students through partnerships. This includes nurses, healthcare providers, and community partners are welcome, including philanthropists who support their missions and can help students on their path to the nursing workforce. You never know when you or a loved one may need a nurse one day. So a special thank you to all the nurses across the nation. And thank you to Dr. Pamela McCue and Dr. Casey Sachs for schooling us about their programs. And last but certainly not least, we appreciate you all for listening. There's more to come next week on the Charter School Innovation Series on the Get Schooled on Public Education podcast. I'm your host, Brittany Baker. And remember, charter schools are free, public, and open to all.
Produced by Heartcast Media.